Let me say something that might make a lot of people uncomfortable. In Nigeria, everybody wants a doctor, but nobody wants to pay a doctor. And somehow, when doctors ask to be paid what they are worth, they suddenly become greedy or heartless. Why? So, if you're a doctor watching this, you might have experienced this firsthand. But if you're not a doctor, this might change the way you see things a bit. Because today we are talking about the double standard doctors face in Nigerian society and why it needs to stop. So let's break it down a bit here. You go to a lawyer, you pay consultation fee, whatever that's being charged there, no argument. You call an electrician, yeah, and you pay for their time, no debate. But when it comes to doctors, it's doctor, it's just small question I want to ask you. It's just advice I'm asking you for. Why are you charging for advice? Like, are you not supposed to be helping people? Like, that is what happens when it gets to the tone of doctors. So let me get this straight here. Every other profession they deserve to be paid for their time and their knowledge, but doctors are expected to work for free. Honestly, yeah, that's not empathy. That's legit exploitation. And it doesn't stop there. When doctors now insist on proper consultation, people now begin to use emotional blackmail. Like, you people don't care about patients anymore. You're doing it for the money. Yes, medicine is a calling. Like, yes, I get it. Medicine is a calling, but it's also a profession. And you cannot weaponize empathy in order to deny someone their livelihood. Some people saying this legit would never tell their landlord, please have empathy now. Don't take rent for this month. Like, where is the ever done? But whenever it comes to doctors, everybody now starts raising their shoulders. So let's talk reality. Let's talk reality. Doctors in Nigeria are already underpaid. They are working freaking long hours. They are burnt out. There's emotional stress. And on top of all of that, here, people or society still expect them to discount their worth or their value just to prove that they are good people. Meanwhile, nobody is asking other professionals to prove their goodness by working for free. So, like, why doctors? Now, this mindset is not just unfair, it is very dangerous. It is legit very dangerous because when you undervalue doctors here, you discourage young people from staying in the system. You discourage them from even entering residency, honestly. You contribute to brain drain and then you weaken the healthcare system. And we all legit suffer from it. Because you cannot keep demanding quality or high quality healthcare from people you refuse to value. It is not just possible. Now, let's be clear this is not about doctors refusing to help. Doctors help on a normal, doctors sacrifice, doctors go the extra mile. A lot of doctors go the extra mile every freaking day for their patients. But help should not come from a place of pressure, it should come from a place of choice. And there's a difference between compassion and legit being taken advantage of. One should not be confused for the other. And one of the things that saddens me most is that a lot of doctors have bought into this ideology that they were or they became doctors in order to help. They didn't become doctors to get paid and all of that. Like, they didn't ever intend to get their livelihood from being doctors, and it's very wrong. If you're a young doctor and you're coming up and you're realizing or trying to buy into this mindset or this ideology, I need you to come down from it like almost immediately, honestly, because this is what is going to crush and kill your career going forward. So there's a conversation currently going on that on Twitter especially about people not being willing to pay for consultation for doctors, but they would go the extra mile to pay for lawyers and everything. And it begs the question to want to understand why that is. I really want to understand what might have prompted you or what your entire ideology about doctors is generally, because I feel like if you have a sister or a brother or a family relative that is a medical doctor, if he now comes to tell you that that somebody did not pay him for a particular service that was rendered, I'm sure you are going to get really pissed at that person not paying. Or if somebody comes to tell you that you did CS for this patient and this is how far and wide and everything you had to sacrifice for that particular patient, and at the end of the day there was no payment or anything, I'm sure you would think that there is something wrong somewhere. I'm sure you yourself, you'll be so pissed at that person. So imagine this being the reality of thousands of doctors in Nigeria. How do you expect them to fend for themselves, to cater for themselves, especially in this economic crisis that we are currently in? You want services, even if it's as small as an advice, and you want them to come and take care of you and reply to your calls, reply to your messages and everything. But then yeah, you don't show any form of appreciation whatsoever. You don't say, or even if they insist on proper consultation and all of that, you are questioning why they are even asking you for that. If it's something they can just willingly give you, if it's something you can just get from them without even wanting to get to the hospital. And it's sad, honestly. It's sad because it is slowly creeping in into our normal, into the normal right now. Honestly, there are a lot of people. I know some doctors that would say or that would tell you that outside of their family, if you're not their immediate family or you never contributed to them being where they are currently, that they will never even give you any medical advice. That if you want to, yeah, if you want to get any medical advice or any form of treatment, whatever for them, you have to pay a certain amount. If not, you're not going to get a reply. We had this conversation towards the end of our housemanship, and I feel like, yeah, I'm even getting to understand it a little bit more these days. And it's really sad that people would want to take advantage of whatever it is you're offering. Maybe because we can just as easily say the treatment for a particular thing, or just as easily our own service comes from a point of just saying or prescribing medication or whatever, or assessing you and all of that. And yeah, even if it comes like that, does not make it of any less value, if you get what I mean. If you think about the whole stress it takes for someone to become a medical doctor and what they are even being paid naturally, I don't think you'd want to take advantage of that person if you are somebody of the right standing or if you actually have a good heart. Well, now I'm not here to appease to the goodness of your heart or anything. I'm just here to talk about what should be. So if you wouldn't give um someone else that is not in your field or someone else that requires your help as a professional the result or a service, yeah, for free, why do you expect the doctor to give you a service for free? Because it's legit their service, them telling you what to do, how to take care of this, how to treat this, what medications to buy. That is still service. Yeah, so why do you expect them to give that to you for free? But what I'm trying to say is that doctors are not beggars. Yeah, doctors are not charity organizations. Your profession as a barrister is not a charity organization. Your profession as an electrician, as a hairdresser, is not a charity organization. So you don't expect a doctor to just vomit out a management or a treatment for you because they can. They are skilled professionals. Doctors are skilled professionals who deserve to be respected and paid. If you truly value healthcare, yeah, you have to start valuing healthcare professionals or healthcare providers because they are the backbone of the healthcare system. And I want to debunk this idea though that we have of doctors in Nigeria. I have to make that specification because there are a lot of doctors elsewhere earning good money and they are a little comfortable, yeah. Doctors in Nigeria, yeah, with the whole economic situation and everything, they are already underpaid. I want us to understand this because a lot of people are thinking, for you to even become a medical doctor, yeah, you should have a lot of money to have gotten that far. Well, yes, it requires a lot of sacrifice. Does not mean that fine. When you now become a medical doctor, you're not supposed to be paid for what you do. Even more, you should be paid even more for what you do, if you ask me. And that is not the case in our society. Doctors are legit underpaid. They need that money to survive. They need that money for their livelihood. They are like normal human beings like you and me. It's just that they had to spend their freaking 8, 10 years to become medical doctors or to learn to treat you better. That is, I feel, the difference between the both of us. So it does not mean I don't need that money that I'm working for, or I don't need the money that is attached to my worth as a doctor. So yeah, pay doctors what they are worth. And if you're a doctor and you've experienced this, I want to know your story in the comment section. And if you're not a doctor, just be honest. Just be honest, rather. Yeah. Have there been any time that you've expected free care from a medical doctor? And how did you really feel when maybe you were turned down, or yeah, how did that experience go for you? And don't forget to like, share, subscribe. Yeah, subscribe if you're yet to subscribe. Yeah. It is important that we have these conversations as medical doctors, as just citizens, or yeah, as medical doctors and as other professionals as well. Yeah. It's important we have these conversations, and I'm going to catch you guys in the next video. Peace.